This is Jennifer Kriegmer, Improvement Advisor at Iowa Healthcare Collaborative. This recording is on the Hospital Engagement Network, or HEN measurement, Catheter-Associated Urinary Tract Infection. This measure has one outcome and three process measures. Zero denominator is allowed. Our data sources, one comes from IPOP, two come from NHSN, and one is self-reported. Looking at our toolkit for catheter-associated urinary tract infections. This includes a description and a rationale, and then it goes through the measures. Our outcome measure for catheter-associated urinary tract infection is the rate. This information comes from NHSN. It's the number of hospital-acquired urinary tract infections. The denominator is the number of acute care urinary catheter days. Our process measures, the first one, unnecessary urinary catheters. The wording on the numerator, number of acute care skilled nursing facility and swing bed inpatients with new indwelling urinary catheters inserted without appropriate indication documented. The denominator is the number of acute care skilled nursing facility and swing bed inpatients with new indwelling urinary catheter insertion. Zero denominator is allowed on this, and this is a self-reported measure. The reason that you would want to do this process measure is if you do not have the CAUTI policy and procedure in place at your hospital. If this is not hardwired and you are finding that you do have urinary catheter infections, then you do need to be doing this to assure that your frontline staff is making sure that the decisions are good, why a catheter is put in, and making sure that it's taken out on time, and doing all the things that we need to do to prevent urinary tract infections. The second measure, urinary catheter utilization ratio. This is the number of acute care skilled nursing facility and swing bed inpatient days with urinary catheter in place. Denominator is the number of acute care, skilled care facility, and swing bed inpatient days. This data comes from NHSN. And the last one, number of emergency department urinary catheter insertions. The denominator, number of acute care, skilled nursing facility, or swing bed inpatients admitted through the emergency department. This information comes from IPOP data or claims data. Looking through the resources for CAUTI, we have many resources, one of which is HRET, the top 10 checklist, which you will see for all the measures. This has the top 10 evidence-based interventions. This is just a great place to look to make sure that you are doing what you need to be doing. And then you can see that we do have an appendix. You just click on that. This is also in the toolkit. This gives you criteria that can be included at a minimum for inserting a catheter. So this gives you some information that's helpful. And the other nice thing about the appendix here is it gives sampling and measurement tips, because please remember on all self-reported measures that we do encourage sampling and that is accepted. If you have any questions on this measure, please contact myself or Jennifer Brockman.